Hello and welcome. I am so excited to be inviting Dr. Cobi Slater onto our podcast today, and we are here to talk about all things MCAS, mast cell activation syndrome. So, a little bit about me. I'm Neen. I'm your podcast host, and the conversation and topic today is mast cell activation. I am also a patient of Dr. Cobi's, which is why I wanted to bring her on. Because you've been so helpful along my recovery journey, and I've learned so much in this process of healing. So I'm excited to have you on and ask all the questions. So we're really going to talk about things right from the journey to diagnosis, Western medicine versus functional medicine, and so many things in between. Before we begin, I just want to say that I've chatted with Dr. Cobi beforehand, and I've given full permission to share everything about my case, because the reason I'm here and the reason I'm doing this podcast is because I want to help other people. I was looking for this information not that long ago. It would have been so beneficial to me. So here we are, the both of us, for the greater good.
Yes.
And just sharing information and what we've learned about mast cell activation. So Cobi, over to you. Would you mind introducing yourself for folks?
For sure. First of all, thank you so much for having me. It's always so great to connect with you, Neen, and always great to do something for the greater good of people, really. So I'm Dr. Cobi Slater. I am a functional medicine practitioner. I have a PhD in natural health sciences. Definitely niching into functional medicine over the past decade for sure, but have been in practice for 20 years. I have a specialty in endocrine dysfunction, so all things hormones. And really what I've found over the years is that my background in functional medicine has probably served me the best with my patients, just being able to create a timeline for patients and have that deep dive. And I will also say that in 20 years, I have never felt like I have a job, because this is definitely a passion project for me. I love connecting with people on an intimate level, and it is definitely my honor and privilege to journey along with people in their wellness.
Thank you. Yeah, and that was really clear to me, being a patient, that you are in this profession for all the right reasons, and you certainly have a helping heart. With that, do you want to tell me a little bit about your why?
Yes, I mean, I got into natural medicine, I would say, because of my mom. So originally I was going into school to become an MD in conventional medicine, and my mom developed a really rare blood disease, and for sure conventional medicine saved her life. She was hospitalized for over a year. She had some very advanced treatments, and for sure her life was saved through conventional medicine. But after she was released from the hospital, they sort of said, okay, like, go home, you're sort of going to be in bed for the rest of your life. You know, we've saved your life, you are alive, but we cannot help you thrive. And so when she came home, she sought out the help of a natural medicine doctor in the town that we lived in, and it was that doctor that really gave her life and health back. And so as a witness to that through my own mom's healing, I switched into natural medicine. And no regrets. I mean, my brain is so curious by nature, and I often think, like, I'm so grateful for the switch, because I feel like I would be very dissatisfied if I was an MD, because I just need to know the why behind everybody's ailments, and I can't just throw a symptomatic Band-Aid on it. I definitely am integrated in my approach. I value conventional medicine, especially with MCAS. I mean, in your case, Neen, I feel like we wouldn't be having this conversation right now if we didn't have conventional medicine helping you along the way. There was some very life-threatening situations that repeated themselves in your life, so we are eternally grateful for that conventional medicine intervention and help, for sure. And I just really believe the marriage between the two, especially with MCAS, is so important.
Oh, 100%, and I couldn't agree with you more.
Yeah.
And I understand you also have had your own journey with MCAS.
Yes, and I mean, I feel like there's no greater experience or schooling than your own personal journey. So when I am 51 now, so when I was 38 years old, I developed a pretty significant heart condition. And I was hospitalized over 30 times. I've had 8 heart surgeries. I've been in the ICU for up to 31 days at a time. So that was a very scary time. And it started cardiac, but then it kind of evolved from there. So when it started with my heart, the focus was on the cardiac system. But then other symptoms started to develop. I started to develop peripheral neuropathy, really strange ice pick headaches. I started to develop some skin issues like hives, angioderma, facial flushing, just a slew of wild symptoms. Like it didn't even seem possible that I could be developing all of these symptoms one after another. And it was through my own deep dive research and functional medicine lab testing that I figured out that I had a severe mold toxicity. So I was working in a clinic setting where the building that I was in, unbeknownst to me, had like 5,000% higher levels of mold in that building than what would be humanly safe. It wasn't visible mold, because 70% of mold is not visible to the human eye. And that was the triggering event for me. And so genetically, I am predisposed to something like MCAS, and the mold just, it accumulated in my system to a level that genetic mutation switch flipped on, and the symptoms came. And because they were so differing and so wild, I was with the cardiologist, I was with the neurologist, I was with the immunologist. No one could put it all together until I put it all together. And then what I learned is that all of my specialists had no idea and no training about histamine, about MCAS, about mold toxicity or anything. So I was really like on my own. And, we're going back over a decade ago. So even in the functional medicine world, I feel like there was not a lot of support and help for me. So it took a few years for me to come out of it. I am happy to say that I am very healed, and I rarely have any symptoms at this point. I would say I am 95% there. Every once in a while, there might be a stressor or maybe an accidental environmental exposure that might trigger a few minor symptoms that brings back a memory of where I lived for so many years. But I feel like I am fully healed, and now recognizing that in other patients, I really wouldn't go back and rewrite any of those chapters, even though it was a horrible time in my life, in my health. I wouldn't change it just because, even with you, Neen, when you were going through the things, like just the level of empathy and compassion that I can share with patients because of my own personal journey it's next level. I've been there. I know what it's like. I know how frustrating it can be. I know how isolating it can be and how terrifying it can be.
Wow, great descriptors. Absolutely terrifying because you have all of these symptoms, and, there are times, you can connect the dots when you're getting a cold. Oh, I feel tired. Oh, I got a runny nose. Oh, I'm coughing. Oh, I must have a cold.
Yes.
But with mast cell activation, the symptoms are completely whack-a-doodle.
Yes.
Whack-a-doodle. And for me, the most significant symptom I realized was just, I have the language and the words now, but it was the serotonin and the dopamine depletion. I had nothing. I remember days just, can I make it up these stairs? In just sheer willpower to get up 12 stairs.
Yeah.
Having a shower, it was like the water on my skin was like just razor blades, and then I'm coming out full polka dots. So this seems like a natural transition into the first question is identifying, what are some of the common symptoms or signs that you may have mast cell activation. And, I just shared a little bit of mine. And again, for me, the very first and strongest signal that something wasn't right for me was I just didn't feel good. And I'm like an upbeat person, and I'm lively, I'm energetic. I love people, I love kids, and you know, I didn't want to be around people. I didn't want to be around anyone because I just felt so like just low, and also just waiting for something crappy to happen because your body is having all of these wackadoodle signals going on. But let me turn it over to you just for perhaps a more functional medicine lens of what a person might experience or changes they might see in their body if
For sure. Yeah, I mean, like the mast cells in our body are widespread and they have an intimate relationship with so many areas of our body. So, first of all, it's not a one size fits all. You know, I was saying earlier to you that you could have 100 MCAS patients and you have 100 different stories going on. So, it's not going to be the same for each person, which makes it, that's one of the reasons it makes it so challenging to get the diagnosis. But so for sure, you know, your some of the more common things you're going to experience in the skin, for example, like hives, rashes, itchiness. In the nervous system, you're going to have that anxiety, depression, just emptying feeling, like what you're describing, the absolute crashing fatigue that can come on. You know, you can have things like the peripheral neuropathy. So a lot of like neurological symptoms. Headaches are really common, but like we're talking, you know, we're not talking a little minor headache here. We're talking next level headaches with migraines. Like for me, it was that ice pick headache. Like it was just like someone had like a pick in my head all the time. It was wild. And then just into hormone dysfunction. There's definitely an intimate relationship between mast cells and estrogen and progesterone and thyroid and cortisol. So you can have any manifestation of the hormones related to MCAS, heart palpitations, changes in body temperature, you know, just the inability to acclimate to different surroundings. So it's so widespread. Digestively, a lot of people will get digestive issues, you know, whether that's even just reflux or diarrhea, alternating bowel movements, gas bloating, just feeling like your digestive system is reacting to everything you're eating. Like it just feels like no foods are safe.
Yeah, and safe is a big word. I'm glad you actually just kind of threw that in there. Safe is a very, very important word when you have mast cell activation. And I recognize that word itself can be triggering for people, particularly if you don't understand what it means through the mast cell activation lens, as somebody who's living with mast cell activation. Yeah. And for me, it does get simpler to categorize things just as safe or unsafe. And in a you know, a simple thing like going to the grocery store. Like I don't know, it was one of those items, probably butter or something we needed. I just ran quickly one evening just to go pick this one item up, and I went in the store, and I don't know if somebody had broken a bottle of perfume or something, but it was just an odor, and it wasn't even necessarily like an unpleasant odor, but it is a full physical and emotional assault on your body. Like I had to just put my crap down and leave the store immediately. And you know, by the time I got home, I was crying. Like my eyes start watering, my heart starts racing, and for me, I feel like all my lymph glands just spasm or react. I don't really know how quite to explain it, but all alarm systems are going off in my body, and I need to be in a cold, dark room to regroup, or straight to the hospital, because it is that quickly that you feel it in your throat, and you don't know if you're going to go full anaphylactic or not.
Well, exactly, and you know, along the way, you had so many anaphylactic experiences that were so terrifying.
Yeah, and I guess that's another thing when we're talking about the symptoms. For me, I certainly experienced post-traumatic stress disorder, or complex post-traumatic stress disorder, just being in that situation so many times where you can't breathe, and also having to rely on a medical system that's fairly broken.
Yes.
I'm fortunate. I have a fabulous internist and have great care between you and the internist. But if I'm if I'm out of town, I'm at a hospital that doesn't know. There's a good chance I'm going to get gaslit.
Yes.
And good chance that I may not be able to access timely care.
Exactly.
So they witness that it's elevating to a level that they feel is an emergency.
Mm-hmm. Yeah, it can be very isolating and very scary in those situations for sure.
Yeah, so we've talked a little bit about some of the symptoms that people may notice. So you talked about just the skin, the heart, and some of the nervous system responses. Do you want to maybe just touch a bit more on some of the nervous system responses? Because I think, particularly if you're not diagnosed and you're trying to figure out what the heck is going on with my body, there are some things that may happen that just seem like way out there. Do you want to maybe just touch lightly on some of those symptoms that are kind of on the fringe and people might even be embarrassed to talk about or not even really sure how to process?
Yeah, I mean, anxiety is a big one. Histamine, a lot of people don't realize this, but histamine is a neurotransmitter. And so it has a pretty big effect on our brain. And when it's elevated, like in mast cell activation syndrome, a lot of people will develop like a histamine intolerance where the histamine's not being broken down properly. And then also because in MCAS, the mast cells are overproducing histamine in response to so many differing triggers that histamine can cause like severe anxiety. So, you're sitting there, you're feeling so anxious, your heart is racing, your palms are sweaty, you could even go into a panic attack and there's no trigger. Like you're not like something happened and I feel this way. It's more like I have no idea why I feel this way. So you kind of feel like you're losing it, really.
Yeah.
So that's a big one. Depressive episodes because of the relationship between the mast cells and serotonin and dopamine, the loss of motivation. And if this comes on at a time, for example, when a female is going into menopause, then the role of estrogen is a pretty big component as well. So a lot of women might have MCAS, they don't realize it, and they might sort of dismiss their symptoms as like, oh wow, I'm having a really rough road with menopause. If there's any level of estrogen dominance, so if estrogen is too high or if progesterone is too low, that can be a huge fuel for those mast cells to overproduce the histamine and inflammatory modulators. So, we might be experiencing like a lot more night sweats and hot flashes, anything within the nervous system. Like for me, I had debilitating anxiety, and that was wild because I'm not I wasn't previously an anxious person. And then that went into like just the cardiac response with the palpitations, which, felt like a stress response in my body. I thought like, oh, I'm under so much stress. My heart's like beating so crazy. But in the end, it really had nothing to do with that. And so we can have all sorts of pretty colorful conversations with ourselves as we're going through this, especially as females. Males are not exempt either, but I think as females, we're sort of like, pull it together, like, what's wrong with you? Like, you can do better, and really we're victims of what's going on in our body, and we don't have power over it. So it's not something we can try harder and do better at.
I'm so glad you named that because there were so many times where it's just like WTF. And similar to you, anxiety or depression weren't in my space whatsoever. Like, I understood people have it. I had compassion for them and empathy and understood some of the puzzle pieces of both anxiety and depression, but it just wasn't something I ever had experienced. And just my thought process around it, I remember just thinking like, I have nothing to be depressed about. I have nothing to be anxious about. So what's going on? And then like with the heart racing, there were so many times I thought, am I dying? What? It's really, really, really concerning. So Let's kind of transition into getting diagnosed and what
Yeah.
are some of the tests, because we've talked a lot about the symptoms, what to look for. So let's talk about
Yeah.
diagnosis.
Okay, so that is such a good question because it's a syndrome. So because it's mast cell activation syndrome, any syndrome does not have a definitive test. So, you can't go to your doctor and say, hey, I need an MCAS test. So there's no definitive test. It's really a diagnosis that is weeded through clinical kind of experience and symptomology. And again, because no two patients present the same, even with a syndrome, like with a lot of other syndromes, there are, a group of symptoms that are pretty like hallmark. But with MCAS, the symptoms there's hundreds of them. And they're also different. And so it's tough to get the diagnosis. It doesn't mean it can't happen. It just means you need to work with somebody who knows what this is in the first place. I think anyone that is going through something significant like this ends up becoming an expert in their own, condition. And so that's where, that really savvy patient hopefully will seek out a practitioner who is knowledgeable in this area. I think from a functional medicine world, some of the tests that I run when I am curious if a patient has MCAS or like a histamine intolerance, I want to look at a few different things. And these are some of the tests that we ran with you. Because when we met, you were in the frying pan of MCAS. I remember our very first conversation, and it was a 10 out of 10. Like, it was like the heat was so high in that frying pan, you were getting scorched.
Yeah.
So for you and I mean, we started with the organic acids test, and we started with the GI map test. So we started with those. I think those are still very important tests. With MCAS, you want to sort of get to an understanding of what is the root of this, because you don't just suddenly develop MCAS. You're not going along perfectly healthy and then, Monday you're good and Tuesday you have MCAS. Like, there's something that has been happening along the way. In my case, it was the mold toxicity. And so, that was definitely my root that turned that switch on. And so it's really important to get the proper functional medicine testing to find out, like, what's the timeline, what's the story here underneath the hood of the car, really. So we did the organic acids. We were looking for mold. We were looking for neurotransmitters. We were looking at nutrient depletion and mitochondrial health and amino acids and liver detoxification pathways. With the GI map testing, we were looking for the connection between zonulin, so intestinal permeability or leaky gut syndrome, looking at the microbiome and seeing what's going on there. We were looking for bacterial overgrowth, like small intestinal bacterial overgrowth, which can commonly run tandem with MCAS or a histamine intolerance. And, looking to see, was there any parasites or viral or fungal overgrowths in there? And then I think one of the really great tests that we did together was the HTMA test, so the hair tissue mineral analysis. When I run that test, I'm running it through the lens of psychoneuroimmunology. So just really looking at trauma in the body and the connection between mineral ratios and toxic elements. That was a lot of information that we ended up getting. And I think that test was really a pivotal turning point for you, for sure. Hormone testing is really important because we want to make sure that there isn't an estrogen dominance going on. If estrogen is high, that's going to promote the mast cell activation syndrome, while progesterone calms it down. So that's important for people to know. And then the mast cells have an intimate relationship with cortisol. So if your adrenal glands are in an under-functioning kind of form, that's going to make the mast cell activation syndrome worse. And it's almost inevitable, because if you're dealing with MCAS, you've had symptoms going on for a while, it's not like the symptoms start on a Monday and you get your diagnosis 5 days later. Like it can be years to get a diagnosis. And so usually the body is totally burnt out, and so the cortisol does tend to be low, and that does tend to make things worse. So, hormone testing is really important. And then there's a connection between mast cells and thyroid. So all of those hormones are super important. And then finally, like, we want to look at food. So, I wouldn't, and you and I didn't do this, we didn't start with food testing. You want to make sure the gut is decently healed before you run a food sensitivity test, or you run the risk of that test just being lit up with everything. And so you want to make sure that the zonulin or the leaky gut is like very stable before you run a food sensitivity or an IgG test. IgE testing is really important because you just want to know what the immune system is reacting to, so you can remove the fuel from the fire.
Yeah, so true. And like you mentioned, the HTMA test was really significantly helpful for me because it identified foods that were a match for me. So I had I guess a baseline of safe foods all of a sudden, where I was, to be honest, I was terrified to eat anything. It got to that point. I had repeated anaphylaxis, and within seconds sometimes of even stepping into a store, my lips would tingle, my tongue would start to swell, and I knew I would have to leave. So I was pretty turned up on the mast cell activation, and those were some of the experiences I was having. So to be able to get just straight to some safe foods that I could eat was so helpful. And the other tests were super helpful along the way as well, because we didn't know what we were dealing with. But even the anti-inflammatory diet, I followed that to a T. It was so helpful, and that was all part of the healing. So I was healing while we were still trying to figure out what was.
Absolutely. Yeah, we went layer by layer and kind of, just dug deep and kept going, and there was, we inched our way to healing.
Yeah, and I guess actually for me, like as somebody experiencing care from both a Western system and a functional medicine lens, that's one of the areas where, I truly felt heard, cared for, and we were going to walk this journey together and figure it out together, which is different from a Western model. So do you want to speak just a little bit about the difference between the two? I'm assuming most of our audience are their own best advocate and have had to do their own research and come to their own conclusions, but I just think there's such value in just pulling this question apart.
Yeah, for sure. I mean, again, I see the value in both in MCAS for sure. Because, again, in your situation, I mean, you needed emergent medical care many times that saved your life. And so we're so internally grateful for that. Yeah. And so the conventional model will treat the symptoms, which, like sometimes people will dismiss that and say like, oh, that's not the approach I want. But like, honestly, with MCAS, like, my goodness, you do need symptomatic treatment, and you need to turn the dial down. You have to live through a minute, let alone a day. And so having that conventional medicine approach with mast cell stabilizers, maybe with prednisone, with some different big hit hard headers, depending on the level of MCAS that's presenting, that's very important. And I think, while that Band-Aid is being put on the symptoms, which that banding is so important, it's going to stop the bleeding, so we need that. Functional medicine comes underneath and looks at like, what is the timeline, what is the story, what are the triggers, what is the root cause, what has led us to this moment where the mast cells started to over-respond to so many different triggers. Like, what happened here? How did this pathway get broken? And it can be such an enlightening journey along the way. For me, like, again, I'm not going to rewrite the chapters if I had the chance, because there was so much growth and healing in so many different ways. And I would imagine that's true for most MCAS patients when they get to the other side, when they're feeling so much better, like the growth that they have had mentally, emotionally, physically, spiritually, all of it. is tremendous, and that's through functional medicine. But we need, again, the conventional medicine to help us with the symptoms for sure.
Yeah, well said. And you even spoke about one of the necessary evils on my journey, which was prednisone. Yeah, and just, I guess, also just knowing that many folks with MCAS, they're going to be using this. Unfortunately, sometimes prednisone needs to be a part of the equation. And that's something that I really struggled with emotionally. I mean, at first I was desperate. As soon as I got it and felt some relief, I know I needed it.
Yeah.
But it really messes with your head.
It sure does. I mean, like, considering that what I do for a living, I had to go on prednisone 4 times at the height of my MCAS, and it was devastating for me as a functional medicine natural physician to have to go on such a big medication like prednisone. But again, I look back and I'm like, well, what else could I have done? Like, my eyes were literally swollen shut. I couldn't even see. The level of hives that I was experiencing was like, it was deforming. It was crazy. And so, I would get on the prednisone, and within a couple days, I would just be like, oh my gosh, I feel so much better. So you got to do what you got to do sometimes, people. And that's okay.
And you got to come off prednisone, and then that's never fun either.
Right. I mean, fortunately, in my case, I was only on it short term. In your case, you're on it longer term and had to do the wean down process.
Yeah. And I did it in hospital because by that point I was in a full mastocytosis, and it was really unfun. But I'm glad we talked about the P word, prednisone, because it is part of the equation, unfortunately.
Well, and you know what? It's like, we do want to talk about it because we don't want somebody out there suffering and not being open to accessing what they need in the moment that they're in. It is not the end of the world if you go on some prednisone to save your life. Like,
yeah, and in my case, it was life-saving and necessary, and I guess it's just important to acknowledge that could be a part of the process, and the benefits do outweigh the negative. Yeah. You also talked a little bit about some other healing modalities, and I know for me there was some other contributing factors that had a significant role in my healing, but from a functional medicine perspective, and from the knowledge you've gained from your own MCAS journey and working with people that have MCAS, where do you see some promising practices, or where do you see hope for other modalities?
Yeah, I mean, in my world, there's definitely, like I would break it down. So there's some great treatments orally, like different supplements that you can take that are very helpful. Like the DAO enzyme is so helpful. It allows you to eat food, which is great. And that can almost be a little bit of not only therapeutic, but also diagnostic. So, because there's no real test for this, sometimes with an MCAS patient, or certainly a histamine intolerant patient, which there's overlap between MCAS and histamine intolerance, but they're not the same condition. I would say histamine intolerance is like the baby version of MCAS. But in both settings, you can take the DAO enzyme for a period of time, and if your symptoms are getting better, then you can pretty much make the complete assumption that, okay, this is a mast cell issue that's going on. So the DAO enzyme can be super helpful. There's different bioflavonoids that you can take to quiet down the mast cells. So things like quercetin, rutin, different bioflavonoids that work as a natural antihistamine. I mean, to this day, I take quercetin every single day, and I probably will for the rest of my life, just as my little insurance policy. So that's really important. I think progesterone, bioidentical progesterone, can be a very important part of a female's journey if they're in perimenopause or menopause, because that can quiet things down as well. So there are lots of different supplements that are super helpful. And then if you know the root, then you want to deal with that. So, in the case of mold toxicity being a trigger, you're going to want to detox the mold out of your system. You want to get into a safe living situation or working situation where there is no mold. That's very important. I mean, at all costs, like, do what you can to get out of that environment. And then, like, outside of that, I think one of the things that goes very unnoticed is trauma. So the work on trauma is massive. There's actually a study that was done on a pediatric group. They kind of followed them. And if your adverse childhood event, your ACE score is high, depending on how high it is, that kind of sets the stage for the mast cells to start becoming overactive in childhood, and that never turns off all the way into adulthood. So, if you're sitting here, you're an adult, I mean, you do want to go back and look, like, start by taking the ACE test, the adverse childhood event. I mean, you can Google it and you can take it online and see what your score is and kind of go from there. But working on trauma is so important. I feel like that is one of the most important things you can do. And I mean, in the end, it's a massive opportunity to do healing in that area that you might not have done otherwise, unless your physical body sort of demanded that you do it. And so that's really important, the trauma piece. And I think that was an important piece for you when you did some massive trauma healing that put you into the next level of healing physically as well. So that's a big piece.
It was so significant, and I'm glad you brought up trauma. Because also just observing on some of the mast cell activation groups that I participate in, trauma is certainly a root cause for a number of folks. And for me, I started seeing really significant gains. I was seeing that, small incremental change when we were in the unknown zone.
Right.
In every one of the tests we did, and following the anti-inflammatory diet, and then when we got more information, switching the foods. The HTMA, that was so pivotal, and it did look at trauma, and all my results said trauma. And then we got the foods from there, and I was able to, trauma's been a big part of this. So there was a significant amount of healing and deep thought around my historical trauma, because you are so unwell. You are laying in a dark room a lot of days because your eyeballs can't handle light, your head can't handle light. It's really difficult to function. One thing we didn't talk about too much was the brain fog, but for me, it was debilitating. It was, there's a line in a Pink Floyd song, your lips move, but I can't hear what you're saying. That was, I'd be in meetings and I'm like, I am completely blank.
Yeah.
Just went blank. But working on the trauma, I'm really grateful. I belong to traditional healing practitioners group. I get to participate in many ceremonies, and I was super lucky to be able to participate in some experiential training with ketamine assisted therapy. And that I'm just blown away by the profound impact that had. So one of the benefits of that particular therapy, and it's not for everyone, but for me, the psychedelic assisted therapy, it turned on some switches that hadn't been turned on before, that gave me greater insight, greater perspective. And the other thing, I can't quite describe it any other way than this, is that it felt like I got a dopamine and serotonin refill.
Right.
Because MCAS knocks the crap out of those chemicals in your body. So it just kind of felt like getting some new batteries. Yeah. So I touched on that one. So going back to the healing process, maybe just if you want to talk a little bit about your own journey. How did you know that you were healing? Clearly you had to do a number of drastic things, like move out of the building and...
Yes.
Talk about healing and some of the signs that you're on a good path.
Yeah, well, I mean, for me, I underwent 8 heart surgeries, so that was wild. But I feel like that was one thing I knew that I was healing, because it was like, a year after year would go by and I'd be like, oh, like, wow, I made it a whole year without a heart surgery. Like, I feel like we're doing pretty good. The neuropathy, it's like, if you could diarize or journal your symptoms, for me, I was like, wow, like the neuropathy is really getting turned down. Like the ice pick headache is gone. I'm traveling with my emergent antihistamines for the hives and the angioedema, but I'm not having to use them. That now I'm on using them as needed, and I'm still packing them with me if I go away, but when I'm unpacking, I'm like, oh, I didn't even use one. Like, this is great, and so less and less of those really medical interventions along the way. And then just being able to participate more in life, I think, rather than clawing my way through every day just to like make it through the day. I'm like, oh, I'm actually like enjoying moments in the day. Like, I'm having time where I'm not thinking about my symptoms. Like, that's a huge measurement of healing for sure for people. Repeating lab testing, I'm so evidence-based. I want to look at, repeat labs and see like, well, what's the difference now? And that's a measurement of healing as well, for sure.
Yeah, similar for me as well, just having a day of symptom-free, and, coming back to the trauma piece, I really spent a lot of time on regulating my nervous system.
Yeah.
There was points, I can get emotional about it, but know that I'm okay. There was points in my illness where I was just in a dark room, just praying. And at first I was praying for death because it would have brought relief.
Yeah.
Like, that's the level of pain and unsettledness. I can't quite describe it. It's like being shooken in a snow globe and just having pain in every part of your body. But for me, like, there were those dark days in the dark room, and like praying for death because it would bring relief.
Yeah.
And even it's been just over a year since I was admitted into the hospital for about a week, and I remember on the drive to the hospital, I already phoned one of my good friends, and by the way, friendships are so important for healing.
Yes.
And I noticed with MCAS, I just wanted to isolate.
Yes.
But I'm so grateful I have such amazing friends. But I was so sick. I was maybe 120 pounds, if that. Mm-hmm. And I had an appointment with my internist. And I remember doing the drive, and I wanted to go by myself because I didn't even know if I was going to make it. I didn't want anybody else to see me in that state. But I phoned my friend and I said, I just need you to meet me at my doctor's office, and we're going to apply for MAID. I just need you to be with me. Mm-hmm. And she's such an amazing friend. We just have this agreement. We just don't question each other. She's like, yeah, I'll be there. And so she met me. And anyways, I ended up getting admitted into the hospital. And we got a lot of things figured out, in those 7 days being in there. But the nervous system regulation is just so important. And I remember, when you talked about, when you get to the other side, it's so different. And I remember that first glimmer of light of the other side. It was just, again, laying in that dark room and just praying. And I remember just hoping, like, what would it be like if I wasn't sick? And then remembering the body will always want to return to homeostasis.
Yes, it will.
And I just kept focusing on that. How do we get back here? How do we get back here? And for me, it did require just full isolation and concentration and rewiring.
Yeah.
Yeah.
Yeah. Yeah, and that's so important. I mean, I feel like along the way, it's inevitable that people are going to get gaslit by the medical community, maybe by friends, maybe by family.
Yeah.
I mean, I feel like in my situation, friends and family, my husband, my parents never did not believe me. And so, like, if you can surround yourself with a few precious people that support and believe you, like, that is so important. Because I would present into the ER in ventricular tachycardia, which is like a very dangerous heart arrhythmia, I would get so gaslit in the ER. Like they'd be like, "Oh, are you having a bad day, ma'am? Like, are you just feeling a little anxious?" And I was like, "I'm in a sustained, dangerous arrhythmia." And they would not believe me. I mean, one time I had to call my husband. He's a police officer, and he had to come in his police car in uniform, blast into the ER, and just be like, "Help my wife right now." And then when they finally hooked me up, they were like, "Oh my gosh, you're in a very dangerous heart arrhythmia. You're about to die. Here comes the paddles," right? And it's like, wow, the gaslighting along the way is remarkable. And I feel like it's inevitable with MCAS because it's not understood. I feel like a lot of medical communities are not educated in it. It doesn't not make it real though. Like what you're experiencing is real. You need the right people around you. You need a community of support. Honestly, even if it's just one person,
Yeah.
you know, even if it's just that one special person, but we definitely need support in order to heal our nervous system because the nervous system is a huge part of this.
Yeah, and that's the thing. Like it's all of these things happening outside of our control,
Yeah.
which are normally in somebody's control.
Yes.
That's part of the gaslighting experience. So
Yeah.
it is very real, and you do need that advocate. And same with me. Like my husband was just amazing because part of the process leading up to the diagnosis was being steroid dependent. So having Addison's disease, you need the steroids. So if I vomited or had diarrhea, that meant rushing to the hospital to get the injections of the prednisone because my life was dependent on prednisone. So yeah, you do need an advocate. And you know, the other thing that I would think is really important to say to folks is if you do think you're having an attack, part of surviving trauma is you're hyper independent. So I was always like, I'll just drive myself to the hospital. I've done this a million times because I've had chronic kidney stones and I've had to drive myself many times. And that's really not safe. So if you are somebody who's dealing with MCAS and you are hyper independent, it's really wise to have an advocate with you because you just don't know if you're going to make it to the hospital. And also if you do get there and they're not listening to you, it's so helpful to have somebody else that can advocate on your behalf.
Yes. And I mean that independence, that hyper independence comes out of, you know, repeated circumstance where, you know, nothing makes sense. And so you kind of just isolate and internalize, and you don't want to bother people with like another bad day, another symptom, another manifestation of something that doesn't make sense, you know?
Yeah, it is quite a journey.
It is.
Yeah. So we've covered a lot. We talked about functional medicine versus Western medicine. We talked a little bit about symptoms. Talked about the healing, the role of managing your nervous system as a part of your healing process with MCAS. Anything else that you wanted to speak in, or any other thoughts?
I feel like I really want to say trust your body, trust your intuition. Like, we know what is normal for us and what is not normal. I want to give a quick, interesting story that happened 2 years ago. So I was well into my healing era, we'll say, and I started noticing some symptoms return. And I said to my husband, okay, this is really weird, but I'm getting neuropathy back. I have an ice pick headache. I'm getting some really familiar symptoms in my body. And he's like, what do you think it could be? And I was like, I have no idea. Like, so, you know, we're running through the list, like this. It's like, no. And I'm like, what? Like, why is this happening? And, you know, I'm like, something is happening. This is not happening for no reason. And about a month after the onset of those symptoms, we discovered that we had a leak in our water purification system in our home. And that leak had been going on for several months, and there was mold underneath the floors in our home. We had no idea. And it was to the level that we ended up having to do a full remediation of our home, move out of that home for 8 months. And our home had to be taken down to the floor joists. Like, it was really intense. But my point is that my body told me, You know, I was listening, but I just couldn't like figure out what the answer is, you know? There's been other situations where I've walked into a hotel room and been like, nope, there's mold in here. Like I can just feel it, I can sense it, and like it's like that PTSD response where you're like, I got to get out of here immediately. I want to encourage people to listen to that, because we don't gaslight our own selves. That's the thing. And so our intuition is there for a reason. And yeah, so I just want to encourage others to fight for that.
So important. I'm really glad you said that, because when my symptoms really started coming on, my first reaction was to ignore them. I got shit to do.
Yeah, I don't have time for this.
Exactly.
Yeah.
So I tried to ignore it for at least a year, and things got worse and worse. And and it was probably 2 years of lots of ER visits. And I mean, a lot of this was during COVID. You couldn't get a doctor appointment anyways. So
yeah,
a lot of craziness. But had I just listened to my body instead of trying to ignore it for a year, that probably would have been helpful. And also just giving yourself that respect, like listen to your body, you know.
Mm-hmm.
And like I said, you know, like there's stores I would walk in and just within 5 seconds in that doorway, I'm just like, oh, okay, my lips are going mold, something, I can't hang out here.
No, you can't. And make no apologies. Like, do what you need to do, people.
Yeah, it's necessary. You only get one life, so you got to make them.
That's right.
Yeah.
Yeah.
So as we're kind of sunsetting our conversation, I'm curious, what's your highest hope in terms of impact for our conversation? I'll be sharing this in some forums, and curious what your highest hope is.
My primary and highest hope always is connection. So that's foremost. I feel like that is so important in an isolating condition like MCAS. So connection, I hope that people that are struggling listen to our conversation, that they also see glimmers of hope, because you and I are sitting here well, like we're doing well, and they can too. So connection, hope, information, like seeking out someone to help you and guide you along the journey is so important. So finding a practitioner that is literate in MCAS is so important. Whether that's in the functional medicine world, the conventional medicine world, like wherever you get your help from, get your help. That's so important. Community, super important. So, and just not ignoring the symptoms, and not putting a hand up to the relationships in your life. People do want to help others. And I think when we're struggling, maybe one of our first human instincts is to just say, like, I don't want to bother you. But bother your friends, bother your family. They love you and they want to help you.
Oh, so well said. So well said. And there is so much hope. I mean, I won't put any pictures on here, but I mean, you've seen me when my face was giant, and my husband is quite the character. He's a bit silly from time to time, but I mean, I would be, my office is downstairs in our house, I'd be down here and he'd be upstairs, and he'd yell down, hey, are you okay? And I'm like, yeah, I'm fine, why are you asking? He's like, well, I was worried your head might have got stuck in the door frame. It was so massive, like I was afraid my hair was gonna fall out because my skin couldn't have been stretched anymore, like, and I was polka dots all over my face, like, so yeah, there's hope. And I am so grateful for my life. I am so grateful for, where I'm standing today in terms of, our company, our friends, the relationships I have, the places I want to go, the dreams I have. I feel alive again. And there's a very long time where I felt very dead inside and very hopeless. And just like you said, Cobi, there's wonderful friends and family who do want to be a support, and we're often not thinking very clearly because we're so dopamine, serotonin depleted, among other things. Yeah. So my highest hopes are the same. So I'm hopeful that you got great value out of this podcast, and feel free to share it with others who may also be struggling with MCAS. Yeah, so that's it for me. Yeah, my final words of wisdom are, if you don't have answers yet, keep looking. Find a professional that won't gaslight you. And create a circle of support. I got a circle of homies that I know that will see me through a million more MCAS flares.
Yes.
I'm not going to have them, but I'm grateful that I've got friends.
Exactly.
Yeah. All right. Final words? Anything from you, Cobi?
Yeah, I'm just keep going, people. Don't give up. Just, bring it down to hour by hour if you need to, but you're going to get to the other side of this. There is hope, there is healing available to you.
Yeah. And here's two people who have overcome MCAS.
Yes.
Still on the radar, still kind of on the back burner. It's there. But we're pursuing our dreams and living our life. So
exactly.
There is hope. Cobi, I'll put your contact information in the show notes in case people want to reach out, find out more about testing.
Sounds good.
And people will know how to reach you.
Perfect. Happy to help.
All right.